Hello dear friends, myself Dr. Kanchan Durukar. I am a fertility consultant practicing in Pune since 10 years. Today we are going to talk about yet another important and a simple topic, and that is ovulation study, or also we call it as a follicle monitoring. So why we do the ovulation study of follicle monitoring? It is basically to see whether your egg is growing or not and whether it is getting ruptured or not. So generally the basic test first we do whenever you visit a fertility doctor or fertility consultant. We do a basic test of a female partner, that is in the form of hemoglobin testing, some viral markers we do the sugar levels, then we do prolactin level, thyroid level, and very important is the AMH level, that is the anti-Mullerian hormone test. And for male partner we do is the seminalysis, viral markers, blood groups, and some basic tests. So this after this basic test, generally ovulation study starts from second day of your cycle. So on second day we do the scan. It's very important. We rule out is the follicular cyst or any and a simple cyst, that is actually a fluid filled cyst which should not be there on your second day, so that if at all we are starting your ovulation induction or we are giving you some drugs for ovulation, this follicular cyst should not increase in size. Now how frequently this ovulation monitoring is done, or follicular monitoring is done after second day of your scan. Generally you are called on 8th day, then and 10th day, then 12th day, and generally if your cycle is regular, then the ovulation will happen around 11th day to 16th day. So depend upon the follicular growth. And generally what happens is the eggs grow is 2 millimeters per day. And also there is a growth of endometrium. So endometrium is the inner lining of the uterus, and that also grows. And the ovulation is the collapse of this follicle. So where the egg that was growing has generally collapsed, or it has vanished, we may say. So that and there is also a free fluid in the pouch of Douglas, that is this egg has released some fluid, and that free fluid in the pouch of Douglas is also a sign of ovulation. Disappearance of the dominant follicle is also a sign of ovulation. Mild pain you may feel, and yes, so these are all the signs of ovulation. So after ovulation has been confirmed, you should have a natural try, and your fertility consultant can also give you some progesterone in the form of oral progesterone or pervaginal progesterone. This also helps, and natural release of progesterone from the ruptured follicle is also there, that can also help you in the pregnancy. And yes, alternate day natural contact also is beneficial for conception. And if at all you have prolonging of the cycle, then check for urine pregnancy test. And if at all you again have a period, you will have to again visit for further ovulation monitoring. So this is about the ovulation study or follicular monitoring, and how it is done. Generally, yes, important thing is generally after the follicle has received reached up to a dominance, that is we call as a 18 mm and above, 18 to 20 mm, that is around 2 centimeter, then we give is the trigger injection. Also we see for the blood flow of that egg, that is blood flow of the follicle, and if it is good, if it is 80-90%, more than 50% blood flow is there, then we give is the trigger injection. Trigger injection is the injection given for rupture of your egg. And after the rupture, generally after the trigger injection, after 36 hours, this egg ruptures and comes into the fallopian tube. And this is the most fertile period of where when the egg is most potential to change into a zygote and an embryo and give the pregnancy. So this is the trigger injection is also very very important injection. This can time, and this can assist you in the ovulation if at all it is not happening. So this is about the follicle monitoring, and it is the most commonly done, but it should be done meticulously. It should be done by proper fertility consultant if you want a better result. So this today's video was about ovulation study or follicle monitoring. I hope it was an informative video. If at all any further information is required, do reach to me. Thank you.